Hi, my name is Mark Rowley, and I am a BSN nursing student at Florida State College of Jacksonville. And this presentation is going to be on cannabis and healthcare and how it reduces the use of opioids. And this is for my evidence-based practice class under Professor Dr. Peggy McCarthy. So the question that I'm posing here, in patients that are being treated for pain with prescription opioids, does the use of cannabis better manage the pain and decrease the patient's use of their opioids? And I'm certainly going to present evidence of this as we roll along. So the presentation that I did was actually at Gateway Community Services in Jacksonville, Florida, which is a drug and treatment recovery center. And that presentation was done on August 10th with a paramedic, a nurse, as well as a social worker and a mental health therapist that are active in the treatment of persons in recovery for substance or opioid use disorder. Before we get into the answering the question, it's important to get a little backstory. The backstory is that on November 4th, 2016, Florida voters were posed with Amendment 2, which was a question of, do we legalize medical marijuana? And overwhelmingly, over 71% of Florida voters said yes. And most recently, in July of this year, there was an overrule of the law which allows now for smokable marijuana in the medical side. So Florida has the Office of Compassionate Use for medical marijuana use, which allows, currently we have over 100,000 users in the state of Florida that are lawfully allowed to use medical cannabis. As far as the United States goes, there's over 25 states now that have legalized the use of cannabis. But there's one big problem here. It's the FDA. The FDA still lists cannabis as a Schedule 1, which basically means there's no accepted medical use and it has a high potential for abuse. This is really putting this restriction on the FDA really puts the hospitals and the healthcare facilities in a quandary to allow the use of cannabis on its premises, or to allow even a patient to bring in their medical cannabis that they were lawfully prescribed. Not only is this putting the hospitals in a quandary, but the FDA's classification of cannabis as a Schedule 1 also really limits the healthcare providers and nurses' ability to discuss the use of cannabis with the patients. And there is no recognized supplier or dispenser of medical cannabis. So that also puts the hospitals in a position. Many hospitals do not have policies, and they're simply not allowing medical cannabis on their facilities. And the Joint Commission, which of course a lot of the hospitals go for, their standard 030105 states that hospitals must safely control medications brought into the hospital by patients, by their families, and by licensed independent practitioners. And unfortunately, many healthcare facilities and hospitals, in the absence of developing a policy for cannabis, they're simply saying it's not allowed on premises. And quite frankly, this flies in the face and affronts and very much disrespects the right of patients who have a lawfully prescribed medical cannabis. So back to the question. In patients being treated for chronic pain with prescription opioids, does cannabis better manage your pain and decrease opioid use? And the reason that this question is important is because there's been an alarming skyrocketing in opioid use and overdose and deaths. The United States has seen over 70,000 deaths in between 2015 and 2017. Here in Duval County, Jacksonville, Florida, we're number 2 in the state of Florida. So there's no doubt that the use of opioids, which is a Schedule 2, by the way, is killing people. There is absolutely no doubt the use of opioids is killing people. But yet, my soapbox, Schedule 1 cannabis is outlawed by the FDA. But let's look at one study. In 2016, a study by Bradford and Bradford that was published in the Journal of Health Affairs clearly shows that there's a decrease in prescription pills that were prescribed per physician in states that allow medical cannabis use. These researchers also reported that the enactment of a medical marijuana law was associated with a 6% decrease or lower rate of opioid prescribing, which again, ironically, is a Schedule 2 substance. One of the studies I did for this paper was a paper to to answer this question is the Journal of Pain Control Study 2016, and in their study they found that 64% of participants reported a decrease in opioid use when using medical cannabis. Now it's important to know these participants were legally authorized medical cannabis users who at the same time had a prescription for opioids due to a diagnosis of chronic pain. And in the average prescriptions that the participants had was 2.38. While after, though, their cannabis use, the number of opioid prescriptions dropped 1.81. So not only did 64% have a decrease in use of opioids, but the number of prescriptions also decreased by the providers. This is remarkable. In the second study I did on the internet, published in the International Journal of Drug Policy in 2017, over 374 participants took part in this study. 71% of the participants reported substituting cannabis for prescription drugs, alcohol, tobacco, and illicit substances. Again, another just absolutely glowing example that medical cannabis use can absolutely play a significant role in reducing morbidity and mortality from opioid and drug use. As part of the presentation I did at Gateway, I did provide a flyer, a brochure here as you can see, and the brochure talks about what is a cannabinoid, as well as it lists some local resources for nurses, and it also provides a list of licensed providers here. And I also listed some of the top 10 benefits, as you'll see, that have been shown with the use of medical cannabis. Patients that are suffering from cancer, seizure disorders, glaucoma, migraines, multiple sclerosis, Crohn's disease. Recently met a patient just last week, up in Maine, that was scheduled to have surgery and basically partial colectomy because of Crohn's. And after 1 year of simply juicing the cannabis stalk, the marijuana stalk, not even the THC, not even euphoric, 1 year of simply juicing in a blender and drinking, Crohn's disease, no lapses, no flare-ups, no surgery, my friends. I'm telling you, medical cannabis has proven legitimate medical use. FDA needs to get with the program. All right, so off my soapbox again. For hospitals that say, hey, okay, we want to honor Florida's law. We want to honor the rights of people to bring in cannabis into our facility. They need to have a policy. The nurses need to have a policy and a standard and a guideline with which to handle medical cannabis. Hospitals need to do this. So the Washington Healthcare Association has made available a sample hospital policy on their website. Here it is right here in front of you for handling the cannabis. And this policy is simple. It's a page and a half and it conforms to JCO. There's no reason the hospitals cannot initiate this policy, and nursing homes for that matter. Here's a list of references, and then also I'm going to bore you with a little bit of part of the presentation that I did that was recorded, and I'll let you hear just a few minutes of the start here. The question I propose is, in patients being treated for pain with prescription opioids, does the use of cannabis compared to cannabis, compared to no cannabis use, which means licit or illicit cannabis use, does it better manage pain and decrease the patient's opioid use while they still have a legitimate opioid condition? So that's the question. And my research shows yes, that in fact, the research, just going right to it, in one research study, research is American Pain Society, in their Journal of Pain, right, was a study in 2016 that basically showed that the percentage of participants who self-reported a decrease in pain was 64%. And this was 374 participants that were given a survey. 374 were, as far as the criteria, they were 18 years of age or older. They had a medical use card, so a medical cannabis card. They also were diagnosed. So this was not something that pain is defined as anything beyond 30 days. for this use of this study. And they were using non-cannabis medications. So they had prescriptions for opioids, non-steroidal inflammatories as well. 374 people took this study over a 2-year period. And again, it was self-reported, so just turn in the questions. They were not paid for it. The University of Michigan actually reviewed everything under their IRB. And the results showed that 64% of patients of the participants reported a decrease in pain. And they also reported that so prior to medical cannabis use, their use of opioid medications was 2.38 on average. They were using 2.38 types of prescriptions, so almost 2.5. After cannabis use, they reported using 1. So basically, we theoretically say almost a pill less on that. Well, when you break it out over a prescription, that can be pretty significant. So that's one study. So briefly, just want to recap that to answer the question, does cannabis use decrease the use of opioids? The answer is undoubtedly yes, it does. And after this presentation and engagement with Gateway, I learned there's many more barriers to allowing patients to bring in cannabis, particularly with treatment providers that are dealing already with substance use. And there's a prevailing belief that in persons in recovery for opioid use disorder, no one treatment regimen will fit the whole, and one person's treatment will be different from the next. Some people benefit from residential treatment, some benefit from intensive outpatient, some may benefit from a 12-step program, others may benefit from abstinence, some may benefit from buprenorphine or methadone, some sort of basically other form of narcotic, of a weaning, or Vivitrol, particularly for alcohol dependency. But by and large, there is not one drug treatment center that will allow cannabis or marijuana on its premises simply because of the FDA restriction of Schedule 1. And unofficially, cannabis is being used for harm reduction and risk reduction. To date, there's not been one death associated with cannabis, but I can count 70,000 associated with opioid use. And I can count simply and give you the names of 4 people that I know that have died in the past 2 years from opioid use. I've gone to 4 funerals because of overdose. We simply need to challenge the government. We need to challenge our facilities. We need to challenge our employers on where is the policy that will simply respect the rights of patients to use medical cannabis. Thank you for watching this.